The information you will listen to in this video has been prepared by making use of the package insert of the drug. If the video is useful to you, don't forget to like the video and subscribe to the channel for support. Emgality, a monoclonal antibody belonging to a class of drugs called calcitonin gene-related peptide antagonists, is offered as a 120 mg pen injector. The active ingredient of Emgality is Galcanezumab. What is Emgality? What does it do? This medication is used to help prevent migraine. It is used to prevent migraines for adults who experience at least 4 migraine days per month. This medication may work by changing the amounts of certain natural substances in the brain. Using this medication can help improve your ability to concentrate and do your usual tasks. It is also used to reduce the frequency of headaches during a period of cluster headaches, when other treatments to prevent cluster headaches have not worked, or have not been tolerated. How to use Emgality pen injector? Before use, take this medication out of the refrigerator. Remove the syringe auto-injector from the package and let it warm up to room temperature for at least 30 minutes. Do not heat this medication any other way, such as by heating in the microwave or placing in hot water. Do not leave in direct sunlight. Do not shake this medication. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. Do not inject into areas of skin that are tender, bruised, red, or hard. Avoid injecting into skin areas with scars or stretch marks. Inject this medication under the skin of the thigh, abdomen, buttocks, or upper arm as directed by your doctor. The dosage is based on your medical condition and response to treatment. For prevention of migraine, usually the first dose is 2 injections, one right after each other. After that, the usual dose is 1 injection once each month. Use this medication regularly to get the most benefit from it. For treatment of episodic cluster headache, the usual dose is 3 injections, one right after each other, at the start of the cluster period. While the cluster period lasts, use this medication monthly. Each monthly dose is usually 3 injections. To help you remember, mark the days on the calendar when you need to receive the medication. Here's what you need to know before using Emgality. Before using Galcanezumab, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. Before using this medication, tell your doctor or pharmacist your medical history. Before having surgery, tell your doctor or dentist about all the products you use. During pregnancy, this medication should be used only when clearly needed. Discuss the risks and benefits with your doctor. It is unknown if this medication passes into breast milk. Consult your doctor before breastfeeding. What are the side effects of Emgality? Redness, pain, itching, or swelling at the injection site may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. If this video was useful for you, like the video and subscribe to the channel for support. Share your views and experiences in the comment section. I wish you healthy days.